parallels between space applications and medical industries is fundamentally in the lack of tolerance for risk of failure. To do that, both groups of engineers and implementers must comprehensively understand how their systems work so that their failure modes can be understood and mitigated in design and checked for in manufacturing and field implementation. First thing I would want to do is understand the job. So who is the surgical robot for? Where is it going? What is the environment? Who's the intended operator? Who's the one that's paying for it? Because all of those things play into the design. You have to design it to cost to be successful. It has to match the operators, how much brains, how much smarts would go into it versus how much is reliant on the operator. What is the operator training cost? And so getting a big picture feel for the problem would be my first step. So in terms of balancing cost, quality, innovation, this is the same that's faced by essentially all of us developing new products. And again, I think it's a very big picture look, understanding how those pieces of your devices interact, and then optimizing for a given situation. Is it being driven by cost, development cost, recurring cost, implementation cost, technology, regulation? Is it a brand new device doing something that's never been done before? This has its own unique challenges. Is it, for example, a new blood sugar meter? I think those are very different problems in development. So again, I would start with the very highest level of the challenge and then work down to the details. So I have had the opportunity to speak around the country, around the world. I think the value of conferences in any field is the chance to meet people that you otherwise wouldn't get to meet, listen to how they have attacked problems in their own field to provide inspiration, ideas, and insight that you otherwise wouldn't get if you stayed at home. I've had a very good time so far, and I'm sure the rest of it will be just as enjoyable. You know, as I like to say, I've heard that talk before, and so it's people's questions and their excitement and wanting to share it with me that's really the most fun for me of these types of talks, which is actually a highlight of my job.